Welcome, everyone, to the People's Health Briefing, a key component of our Trusted Voices campaign. I'm Dr. Noha Abalada from Roots Community Health, reporting for the week of December 9th, 2024. As health professionals rooted in Oakland, serving some of the most marginalized communities in California, we're here to cut through the noise and bring you the latest information on health issues relevant to us all. The goal of the People's Health Briefing is to equip you with the best knowledge and insights to keep you, your loved ones, and your community as safe as possible. Today, after our public health updates, I will talk about telehealth and also let you know about some new vaccine guidelines from the CDC. Starting off with respiratory viruses, this is the respiratory virus tracker. This one is showing the percentage positives of all of the testing that is reported to the national surveillance system. So it is a small subset of tests, but we do think it's enough to give a good idea of the proportions of respiratory viruses that are affecting folks, those that are seeking care. And the largest percentage is still rhinovirus, enterovirus. There's no specific treatment for those viruses. They cause the usual respiratory symptoms, cough, congestion, and so on. But it does look like it's trending down a little bit, while RSV, which is that green line, we can see is starting to pick up a bit. And it's a little harder to see, but the bright blue line there is influenza. That's also starting to come up a little bit, while SARS-CoV-2 in the red is looking relatively flat. And again, this is not about the total number of positives. This is that percentage of the total. We know that a lot of people are testing for COVID at home, so those folks may actually not go in to get tested. So that's something to keep in mind as well. But overall, I think it's helpful to see how these things are related to each other, particularly now when we know that there are a number of respiratory viruses circulating around in our environment. So why should we care? Well, there are a few reasons to care. The main one is that if you're someone at risk of a bad outcome and you get one of the treatable viruses, we really want you to know that right away so that you get treatment. So in general, it's just good to know what is really more prevalent out there in the environment. But of all of these viruses, the only ones with specific treatments are flu and COVID. So if we can recognize what you've got early and get you treatment immediately, then we could actually save a lot of hospitalizations and even deaths. The other important reason why it's important to differentiate is about caring for one another, because we know that by far the most contagious of all of these is SARS-CoV-2. And with SARS-CoV-2, we know that you can be contagious even before having symptoms. While with most of the rest of these, by the time you're contagious, you're actually feeling bad. So you have a less likelihood of going around and spreading it to others, as long as you're being considerate and not going around other people when you're sick and getting them sick. And unfortunately, we know that SARS-CoV-2 causes outbreaks and super spreaders, and it spreads very quickly. And it spreads before the person may even know that they have it. So for all of these reasons, I think it's good to have a general idea about what's going on in the environment. And it's especially good to be aware if you're someone who is going to need treatment for flu or COVID, you should have a treatment plan to get tested and treated in a timely fashion. And taking a look now at this graph, which is from a newer page from the CDC website, which I've linked in the post. It's called Respiratory Virus Activity Levels. And the page is kind of like a little one-stop shop, just high level for a summary on COVID, flu, and RSV. This particular graph is showing the weekly percent of total emergency department visits that are associated with each of those viruses. And COVID is in the orange. And of course, it had come down considerably, but we can see that in the last week reported here, which is the week ending November 30th, it's actually starting to tick back up a little bit. And we can see that the influenza in the blue and the RSV in the purple are headed up as well. So still relatively low, but it does look like things are starting to pick up. So as we head into the winter season, we're going to be keeping an eye on this, because it looks like perhaps our winter viruses are starting to pick up. And we're still keeping an eye on SARS-CoV-2 in the wastewater, which is looking low on average nationwide. It is heading up just a bit in the Midwest. Also, in terms of variants, no news is good news. There hasn't been anything alarming in terms of new SARS-CoV-2 variants, which are continuing to be monitored both in respiratory specimens as well as in the wastewater. So let's hope it stays that way for a while. And we can see here percentage of emergency department visits with diagnosed SARS-CoV-2. So we can see this a little bit more clearly than on the graph I just showed with all three viruses. And definitely, unfortunately, we can see here that it is ticking up. Not only is this graph more clear, but it's actually a little more updated than the other one. This one is showing us through December 5th. So it may be that we have reached a low point with SARS-CoV-2 and are heading back up for the winter wave, but that remains to be seen. And taking a look at deaths, we know that this indicator lags behind. And so this is showing us up to the week ending November 9th, so about a month old. And so as we would expect, those are continuing to come down, following behind what we were seeing with wastewater and emergency department visits. And so if indeed we've reached a low point and are heading back up, then we might expect deaths to do the same by about early January or so. But it doesn't have to be that way. If we were better about getting folks vaccinated and we were better about getting folks eligible for treatment, then it would not have to mean that the deaths would necessarily have to be up this high and going up so high just because cases were increasing. But unfortunately, that is how it has been. That is the pattern that we are in. We're still over 500 deaths per week. So far, there have been 517 deaths reported for the week ending November 9th. And now taking a look at enteric viruses, or the ones that primarily affect the intestines, we see that norovirus continues to climb. We've seen scattered reports about restaurant outbreaks, cruise outbreaks, things like that. This isn't out of the ordinary per se, but the percentage of tests that are coming out positive for norovirus is certainly higher than it was last year. We never got over about 13.5% positive for the entire year last year, but here we are over 17% test positivity and climbing. So when we're looking at percentages, it's just hard to say whether this has to do with how much testing is going on or what other stomach bugs are circulating around. But I think it's always a good thing to be reminded to wash your hands, wipe your high-touch surfaces with bleach wipes or bleach solution. Remember that hand sanitizer or alcohol-based does not actually kill norovirus. Please be careful when you're preparing food, especially if you're preparing for others, especially if you work in a kitchen or if you're hosting holiday meals. Then if you don't feel well, then perhaps the task can go to someone else, but definitely wash those hands and clean those high touch surfaces, because this virus and the virus outbreaks with norovirus is certainly no fun. Now I wanted to bring to your attention about one of the provisions that came about due to the COVID emergency that is set to expire. And this one would be an especially devastating one if it was allowed to expire. And I'm talking about coverage for telehealth. So prior to the pandemic, there was not a whole lot of coverage for telehealth. It was pretty much limited to patients that lived in remote areas and rural places where access was very, very challenging. But as we saw with the onset of the pandemic, there are a number of situations in which telehealth can be beneficial and even life-saving. So this benefit is actually set to expire at the end of this month, so December 31st, unless Congress acts. So I put a couple of links in the post if you're interested in taking action, and I really hope you are. I would encourage everyone to take action because it would really make no sense to get rid of telehealth. And I want to be clear that not everything can be handled through telehealth. I think we know that. We know that oftentimes a physical exam is absolutely necessary, and definitely different types of diagnostic tests and things like that can only be done by going in. But there are things that are just as easily handled through telehealth. And I'll say that in addition to physical exams and diagnostic testing, there are just some things that are difficult to kind of perceive through a computer monitor. So if it's something where we really need to kind of that nuance of a face-to-face encounter, a lot of things can be picked up and perceived during a face-to-face encounter. So I definitely don't want to devalue the importance of having those face-to-face encounters, but it doesn't have to be every single time, and it doesn't have to be for everything. So we're not replacing face-to-face encounters. This is in addition to face-to-face encounters. And there can be a number of reasons why telehealth is preferred. And there's just a number of visit types in which it just makes more sense, actually. So if we're reviewing routine labs, for example, if we're just doing check-in, how are you feeling after we started that new medicine, something like that, where we don't actually need to do a physical, and maybe we've just seen you a few weeks ago, a month ago, then it can just be so much more convenient for the patient, more efficient for the office or for the healthcare organization. And more than that, for a lot of people, it really is a lifeline. So maybe if you are in rural areas or remote areas where access to care is difficult, specialty access may be very challenging, then this could mean the difference between just taking the 20, 30 minutes for the appointment versus your entire day spent driving to get to an appointment and waiting and so forth. But also, even if you are in an area with a lot of access, it may be difficult for you to access because of a disability, because of mobility issues, because you need someone to take you to the appointment, because you have childcare issues, you have transportation challenges, and the list goes on. And so all of these things can make going into the doctor's office more challenging. And if it's not necessary to do it in person, then telehealth is just a wonderful option. And not only that, reducing unnecessary crowds in waiting rooms is also a good thing because we can reduce the spread of illness. We know a lot of people are going in because they are sick. And we've all heard of people who just went for a routine thing to the doctor's office. They had to wait in the waiting room and they got sick at the doctor's office. And so we definitely want to be able to avoid that whenever we can, which is also why we advocate for masking in healthcare. But that's a whole other topic, an important other topic. So for all the reasons that I've mentioned and more, it is essential that we maintain the benefit for telehealth, which basically means that Medicare should pay for telehealth visits. So I hope you will join me in advocating to retain that benefit. You can use the link in the post to find your representative and send them a message. You can also call them. You can also use the form that I have linked there. I did not write the letter, so I can't vouch for it or its contents or take credit for it, but you can create your own letter there, or you can use parts of that letter if you want to, but it does make it a little bit, makes the process a little bit more simple. It doesn't take long. The more people that take this action, the better. It's really important to let our leaders know how critical this is. And definitely, if you're part of any professional association or any advocacy groups, or maybe checking in with your employer, please check in to see what they're doing and if this is something that they might be interested in, because those can also have quite a bit of weight. And I want to just point out that this is important for everyone, not just people on Medicare, because we know that Medicare kind of sets the bar in many ways. Medicare guidelines are followed by Medicaid. They're also followed by many private insurances. So if Medicare stops covering something, it has major ripple effects for everybody. We have seen so many things that were positive that were brought to us in the early years of the pandemic be completely dismantled. And I really, really hope that this will not be one of them. So please take a moment and make your voice heard. And now I want to bring to your attention an update regarding the pneumococcal vaccine. So the pneumococcal vaccine is the best way to protect against serious pneumococcal infections, which can cause pneumonia, and actually they can cause invasive disease, which means that the bacteria actually progresses to other parts of the body, including into the blood, and this can be life-threatening. Pneumococcal disease is more common in children, and it can be very serious in small children, and it can be very serious in older adults as well. So kind of the extremes of age that we've talked about in many instances here before. And for quite a while, the pneumococcal vaccine has been recommended for children under 5 and adults over 65. But the update came about in late October when the Advisory Committee for Immunization Practices, which is the advisory committee to the CDC, made the recommendation to lower the age for adult pneumococcal vaccine to 50 and up. So this is pretty new. The CDC then approved that recommendation or adopted that recommendation. And so now it is advised for everyone 50 and up to prevent hospitalization and even death in adults. And the tool, I will say the tool that the CDC provides on its website to help you figure out whether you should get it has not been updated yet to incorporate this guideline. So I've just linked the actual late breaking recommendation from that meeting that occurred about a month and a half ago so that you'll be aware of it. I know this is the time where a lot of folks are getting those doctor's visits in. Hopefully you've already gotten your flu and COVID vaccines, but if you are 50 and up, then you may want to ask your provider about pneumococcal vaccine as well, and just still also recommended for children under 5. So I thought I would just consolidate the respiratory illness vaccine recommendations here because there actually have been a few updates with this. And so they're all here on one graphic. And so you can see that COVID is now, just like flu, considered an annual vaccine for everybody 6 months and up. And it could also be every 6 months for those 65 and up or those with moderate immune compromise. There's more caveats to this if you have more severe immune compromise and also for our little ones with the primary series. So there's all different additional caveats, but just wanting to keep it general and high level here. Flu, as we know, annually at the onset of flu season, which is usually September, October. Now, this flu season seems to be getting off to a little late start. So if you haven't gotten your flu vaccine yet, now is a great time to do it and get yourself protected during those peak months that are no doubt ahead of us. And RSV is a newer one, and this one is for everybody 75 and up, everybody. And also for those 60 to 74 with underlying conditions or 60 to 74 living in a nursing home, and pneumococcal we just talked about, under 5 and 50 and up. And as we head into more holidays, just a reminder that for a healthier holiday season, we want to really be mindful as we travel, as we gather. And if you are going to be gathering with folks for the Christmas holiday, for the New Year's holiday, be thinking about your schedule. And if everyone who is gathering and getting together wears a mask for at least 10 days before gathering, then that will greatly reduce the risk that you will be there spreading anything around to your loved ones during those holiday gatherings. Of course, testing immediately before the gathering is a really helpful layer of protection. It's pretty simple, and it's particularly important as it relates to COVID for the reasons we talked about before, that you can have people that are pre-symptomatic, so their symptoms haven't started yet, but they're still contagious, and we can catch those folks with those tests and keep them from turning your event into a super spreader. So I highly recommend doing that. If you haven't gotten your 4 free tests from the government yet, please also order those. The link for that is in the post. It's really simple, and go ahead and get those ordered if you haven't done that already. And remember, if you are someone who should be treated for COVID or for flu, then you need to have a way to test as soon as you start feeling symptoms. So have that preparation lined up and know that there are antiviral medications that if you take them right away, you can really reduce your risk of hospitalization and even death. And you will most likely need a primary care provider to help navigate that. So if you don't have one, please get one. Establish a relationship with your primary care doctor. Get your blood pressure and your baseline labs checked. Get the appropriate cancer screenings for your age and risk factors. Know where you stand. And I want to just remind everyone about eating a balanced diet and incorporating fresh foods. I know folks tend to indulge over the holidays, but do what you can to avoid sugar, avoid sugary drinks, avoid highly processed foods, avoid overeating, get some regular physical activity. If you don't feel well, if you're one of those folks that are catching one of these viruses that are going around, please fully rest. Give yourself the time you need to rest and recover and manage those stress levels and get a good night's sleep. This concludes today's People's Health Briefing. Thank you so much for joining us. We'll see you again next Tuesday at 10 a.m.